right now on Fox 5 News at 10.
Well, doctors say they are optimistic about her odds, but it's still not clear how much brain damage she suffered. And we're joined now by neurosurgeon Ezriel Kornel. He treated Press Secretary James Brady after he was shot during the assassination attempt on President Reagan. Thanks so much for joining us. Now, doctors are paying special attention, I'm sure you know this, to the vital signs. When will they know if she's out of the woods?
Well, it's hard to say, Sharon. You know, generally we feel that 24 to 48 hours is the big window in which we need to really watch closely to see if there's further swelling of the brain, because that is the thing that we're most concerned about. Unfortunately, in my years as a neurosurgeon, I've had to deal with many gunshot wounds to the brain, including, as you mentioned, that to Jim Brady. And we really are concerned that the damage that has occurred will induce further swelling of the brain, and that swelling tends to occur in the first 48 hours.
Yep.
So we watch very carefully, we get follow-up CAT scans, we can measure the pressure in the brain, and if after the first 48 hours that doesn't go up further, but in fact seems to start to decrease, then we start to breathe a little bit of a sigh of relief, thinking that certainly the most severe problems may be beginning to dissipate.
Now, I see you're holding a prop there in your hands, and basically you're going to show us they actually removed half of her skull. Is that to reduce some of the swelling and keep her out of the danger zone?
Exactly, because the brain is obviously confined by the skull, and so when pressure builds up, there's nowhere for that pressure to go except to push against the brain. So when you remove that portion of the skull, then you have a conduit by which the pressure can be relieved, and you can save that portion of the skull actually, and often we create a pocket under the skin of the abdomen, and we can place that piece of the skull there and then use it later to reconstruct the skull. But it relieves that pressure, and it gives her a much better chance to recover. Dr.
Kornel, thank you so much for joining us. I do appreciate it.
My pleasure.
Now, for up to the minute coverage of this story, just go to our website at myfoxny.com. It's right there on our homepage.